Each year, thousands in the US are diagnosed with glioblastoma, the most common malignant brain cancer. Despite decades of effort, median survival has only increased from 12 months in the 1920s to about 15 months today. Exvade Bioscience is changing the paradigm in treating glioblastoma. Exvade's breakthrough designated Tumor Monorail is a small implant that provides real-time access to tumor tissue, using a bio-inspired design to direct migrating tumor cells to an accessible collection point for safe retrieval and analysis to track tumor evolution and treatment response. It consists of several key components. The fibercath, a thin catheter, is placed into the edge of the tumor to provide a path for cells to travel. It connects to a reservoir that sits under the scalp and serves as a sterile, self-sealing access port for aspiration in outpatient settings. The reservoir, about the size of a penny, sits flush with the skull to minimize cosmetic impact. From the outside, the implanted device resembles other brain shunt reservoirs, with only a minimal bump thanks to its low profile and flexible dome. First in-human clinical trials following regulatory agency approvals are now in progress at the Duke Brain Tumor Center. Placement and use. Using standard imaging and navigation tools, clinicians choose the target area for implantation and the best location for the reservoir to sit flush with the skull. Surgeons cut the fibercath to the required length and assemble the device for each individual patient, tailoring it to the approach and depth of the tumor. Device assembly is performed using proprietary cutting and assembly tools made for Tumor Monorail, ensuring precise implantation for each patient. Using surgical navigation tools, the catheter tip is precisely guided to the edge of the tumor. Small openings at the fibercath tip extend a few millimeters into the tumor, allowing cells to gradually migrate into the device. Once installed, a low-profile dome seals the device, and the reservoir sits securely on the skull under the scalp. The procedure typically takes less than an hour. From then on, tumor cells naturally travel through the catheter into the reservoir, enabling real-time access to living tumor tissue. Samples can be collected as needed for on-demand monitoring of tumor progression and response to treatment. No general anesthesia, no operating room, just a simple office visit every few weeks. This workflow supports high-throughput drug screening and multi-omics analyses to assess tumor evolution and treatment response with minimally invasive serial tissue sampling. Currently, the missing element in finding and tailoring effective treatments for GBM patients. Early preclinical data also suggest a potential application for local drug delivery and direct reduction of tumor size. Although today, the Tumor Monorail technology is being used only in recurrent GBM patients, its platform approach can be expanded to treat and monitor other hard-to-treat adult and pediatric tumors too. Tumor Monorail. Hope rerouted.